Today we're starting a new series of conversations in LTCCovid, speaking to stakeholders, researchers, and people involved more generally in the response to COVID-19 in the long-term care sector. We'll be speaking today to Jakob Elias Embacher from the European Public Service Union, and also Sylvain Renouvel from the Federation of European Social Employers. We'll be discussing how to prepare the social services sector for COVID-19 and how to increase its resilience. So thank you very much for joining me. Sylvain, I'm going to ask if you could tell us a bit about the Federation of European Social Employers.
Yes, thank you for giving us the opportunity to present social employers. It's a federation created just quite recently in 2017 by 6 employers organizations at EU level. And we are now happy to be 28 members in 17 member states EU. We represent the employers of social services understood as services for persons with disabilities, services for the elderly, for children also in difficulties, and other groups with other vulnerable groups. We are quite growing today, and we are involved in many activities and projects with our counterparts from the Indian side, EPSU, which is represented by Jakob.
And that leads us then to ask Jakob, so can you tell us a bit about EPSU, the European Public Services Union?
Yes, of course. So EPSU is a federation of unions organizing workers in public services. EPSU as a whole represents over 8 million workers across Europe. So really from Ukraine to Ireland and from Italy to Sweden. And amongst others, we organize workers also in social services and especially in long-term care and childcare.
Thank you. So we're going to start discussing a bit the challenges that the COVID-19 pandemic has posed to people working in the social care sector. And I understand that from your side, you've been paying a great deal of attention to this.
Yes, certainly. So for us, since the outbreak of the pandemic, especially the health and safety of workers in long-term care homes has been a priority. We actually invited Dr. Fernandez from LTCCovid to one of our working groups, so that was very welcome. So we always kind of sought, I would say, also cooperation with researchers to build our own capacity, also to advocate for a stronger protection of workers. We also tried to encourage exchange among affiliates. For instance, we set up a database of social partner agreements. I will also come back later to it. We organized a webinar together with the social employers on what social partners can do to promote better health and safety of workers. And then I will maybe come to where we see the challenges. Together with social employers. So we have addressed a range of statements to the European Commission throughout the pandemic to kind of sort of highlight where we see the challenges. And I would especially like to highlight them. Firstly, I think there was really at the beginning a lack of clear measures and protocols coordinated at a national and European level. So what we saw was that for a while there was actually sort of confusion also for workers as to what needs to be done in such a crisis, which has been unprecedented. Then also a lack of testing in residential settings, especially in long-term care homes. Workers as well as residents were long not able to actually access any testings. Or in residential homes, for instance, we saw just recently there was a report published by Amnesty International on the Belgian case, where they show that in order to get access to protective equipment, care homes had to show that they have COVID cases, but they also didn't have access to testings. So that was just a bind that made it impossible to actually guarantee protection of workers. The lack of protective equipment, like I said, has been a big problem. The lack of masks, of disinfectants, of just proper, proper protective equipment, where I think for a long time, long-term care has been treated as somewhat secondary to the healthcare sector. A lack of funding to invest in safety. I think also it's important to point out that I think many of the problems don't come out of nowhere, but they kind of sort of highlighted pre-existing problems, especially underfunding of the sector, which really was exacerbated by this pandemic and very much put in the spotlight. Understaffing, I think, has been a problem for a long time. We know that we would actually need more workers every year as we have an aging population, but unfortunately we don't see that in many countries. So actually the problems that we already have of too little staff for too many people in need is rather than getting better, in most countries it's getting worse. High proportion of people with COVID staying in residential care, which also often meant that they were actually unable to access hospitals. So people in long-term care who were in need of intensive care, because hospitals were overfilled, could not access that. And that also meant that people working in long-term care homes had then to deal with people actually dying in those homes, and they were just not prepared for this. And lastly, what I think is also very important to talk about, and what we have also been discussing quite a lot, is mental health support. That workers in the sectors have often been left alone with this extreme pressure, and also surrounded by they're just not prepared for. And there has not been much in terms of mental health support, in terms of services for those people to help them through this difficult time that, of course, now is very much ongoing, or is picking up again, I would say.
Thank you very much. Quite a long list of challenges there, and I think, Sylvain, you're going to talk about what you're proposing in terms of actions and recommendations to get move forward.
Yes, thank you. And my list of recommendations is longer. We, in the position paper, we agreed on. We made a list of recommendations to the European Commission, but also to the member states, as well as to the providers of services. This list is quite long, about around 10 items. First, what is the most important is to have some relevant and updated recommendations on guidelines, because at the beginning of the crisis, it was a bit complicated about this. Of course, it was new, so as we can understand, it was difficult to provide them. But now that we have some data, we have more information, even if we don't know everything, we need some clear recommendations and guidelines to provide the services without having to think about everything. So it's the first point. For what is close to our preoccupation, so social partners' preoccupation, that's the question of health and safety. Jakob has mentioned it. We made some seminars about this. And the first point, and that's a recommendation we got from OSHA, the Organization for Health and Safety at Work at EU level, which advised us to first think about updating the risk assessment. Something, the thing is compulsory. It's a directive from '99, and that's the first point of any policy of prevention of risk at company level. So the first point is to update risk assessment to be able to provide some new policy and updated policies to go in the right direction. Of course, which comes just after this, after the assessment, but develop the protocols to know in advance what to do in case of. For example, for our case, it's in case a sick person, COVID-19 case is detected in our sick home, than to know what to do in a few minutes, not to have to attend steering committees to think about what could we do to deal with the situation. Going back to the staff also, we need to be sure that the staff is trained to the safety protocols, because we are not healthcare, the healthcare sector, we are social services. So of course we have some information and some protocols about it, but not for such situations when risk is huge to get contamination of a contagious disease. So it's a need of training is quite important. Of course, about to be able to see what is the situation, there's a question of test, of course, which must be available for our services. So for whole residential care, not only for the elderly, because there's also the questions about people with disabilities, which is quite important. Something broader also, winter is the season for influenza. So let's avoid having to face two viruses. So we also provide a recommendation to ask people to be vaccinated. So I mean service users and the workers, because it will avoid more than ever to make the situation more complicated than it is today. We, of course, that was something we missed a lot at the beginning of the crisis. That's PPE, personal equipment. Last point after the risk assessment, all the policies about risk prevention. But of course, it was very important. It is, as far as we know, it's no more a problem today. They are available. The point can be in certain countries that it has to be paid by someone. So if it is paid only by the providers, it would be complicated for them to face the extra cost of prevention. So something to be taken into account by the authorities. What is important also is, Jakob mentioned it, is that psychological support for both service users and the workers, because we faced in the first times people having to face the risk of infection for themselves, for their families. So it's something stressful to think that you can take the virus back at home and give it to kids and so on. So it's very anxious, and this is something that has to be dealt with, and we ask and we recommend to provide some psychological support for care workers. Because sometimes it's not just while during the crisis that's the problem, it's just after. And if we don't want to face huge absenteeism, we have to accompany to provide support. Come also with this, of course, question of funding. Of course, from the EU side, but also the national side, some finance must be financed for the extra cost, for extra working time, extra equipments for security. We also have to train the staff, we told it. And also something which is more broad is also that our services has to be recognized as essential. That's something very important, and we felt very deeply beginning of the crisis. So everybody talking about the healthcare sector, but nothing for the social services. When we realized that we have the same number of persons dying in the nursing homes than in the hospital, something quite equivalent. So, and the workers in our sectors and the services providers has to be recognized as also essential. It's something which is very important, and because it also determines the policies and the funding policies that we will have tomorrow, and long-term care is something to be funded and recognized as something essential for the society.
Thank you very much. And quite a long list there of recommendations and asks. I'd like to ask you, Jakob, just one thing that's come out in previous webinars of LTCCovid was and reports is the issue of sick pay, the entitlement to sick pay for care workers who, for example, need to isolate or who have the virus themselves. And we're understanding that in quite a few countries, this was not available to them, and that meant that they had to make a choice between continuing to work and risk spreading the virus or staying home and then protecting, but then lose pay and maybe also have very detrimental impact to their personal finances. And then the other issue that's come up a lot is the issue of migrant workers who from other countries who maybe are providing 24-hour care and whose precarious employment situation in many countries has resulted in very difficult situations. I was wondering if you'd like to comment. We've seen that through the research, but it'd be interesting to see from your side how that's looked.
Yeah, thank you for this question. I mean, I think you very much already said it. It's really central, in our opinion, that COVID should be recognized as an occupational disease. And this also means that, like you said, I mean, it also just, for one, it's of course in the interest of workers. And at the same time, it of course just makes sense from a crisis management point of view to allow those people who work in long-term care sector, which is very in proximity with people, which makes distancing difficult, to allow those people to stay at home if they catch the virus. I think it's absolutely necessary and certainly something that we demand also. On migrant workers, yes, you're right. This has also been an issue we've seen, especially in countries where the reliance on carers from abroad, from other countries, oftentimes the East, is high. I'm speaking a bit now from my own experience in Austria, where really a large proportion of carers come, especially from Slovakia and Hungary, who have at some point closed the borders, and then there was actually an agreement to allow workers to pass, but this has also not been very clear, which in the end also led to long queues at the border. I think there needs to be really a good coordination to make sure that those workers that countries rely on are able to pass the borders in security. The EU has, I believe, published guidelines on the mobility of workers, which is a good step to do.
Thank you. And now looking a bit more to the longer term, I mean, if there's one thing we know with some certainty is that in the next decades, we're going to need more people to work in this sector because many of us we're going to be hopefully living longer. And we know that we have all these issues. We already have a problem recruiting as many people as we need. And how can we transform this sector? How can we make this an attractive sector where people will choose to want to work and have a good career, a good working life? How do you see things?
I think you make a link with another position paper we agreed on with EPSU, is the position paper on recruitment and retention in the social services, which is highlighting the fact that because of the aging of the population in the EU, which the EU is also working on, because we have a green paper which will come in the next month to update the situation and to anticipate the situation. And also something which is less obvious, but which is also important, is the change in the needs also. People ask for more community services, more linked with the needs of a person, the individual needs of a person, rather than something one size fits all. And then this is also something to take into account in the way we deliver services and also in the training of the workforce, which today I think is not equipped to face these new ways of delivering services. And it's something important which also needs some funding to allow people to train and to replace those in training, because we're talking. And in our in the same time that we have more needs and more individual needs, meaning that more workforce. We see, for example, in my country, in France, we see that the people entering in social care schools and training centers are less and less numerous, and it is decreasing quickly because our sector is not attractive enough because of lots of questions, from pays to working conditions and to other many reasons. We also, I will avoid to list what we put in the position paper, but we identified lots of questions that we can work on, and together with EPSU and on next years we will continue to work on the basis of this paper to identify some solutions for our members, and also for the providers, on workers on the ground level, but also more political at the member states level. And the EU can have a big influence, and this is fun to be on.
Thank you. And Jakob, we had an earlier conversation, and we were thinking of some positive examples where there's been a good improvement in the working conditions of care workers. Do you like to speak about that?
Yes, sure. So from our point of view, of course, it might not surprise you to hear that I think the best way to improve the situation of workers, to make recruitment and also retention better, to improve the situation, because it's also clear that we cannot only look at recruitment and only look at improving the image of the sector if we don't also improve retention, which I think we can only do by providing for good salaries and working conditions. And here I think the key is for workers to join unions and also to strengthen the collective bargaining structures, which are the best tool to increase salaries in the long term and also improve working situations by including also workers bottom up. And the report you were referring to is a report that we have published in 2018, which is called She Works Hard for Her Money, and which looks at a very interesting and a very central aspect of low salaries in social services, which is that it's female-dominated sectors. Similar to healthcare, oftentimes female-dominated sectors are associated with lower salaries. And this report actually provides a collection of trade union responses, of responses found in collective bargaining to this gender pay gap. And one of the solutions, for instance, from Finland, was that in Finland, in a collective bargaining round, the unions and the employers agreed on equality allowances, which means that in addition to the generally agreed upon salary increases in a sector, such as social services or long-term care, there would be an increase based on the amount of the percentage of women in the sector, if it's overly female dominated, as well as the amount of workers who are below a certain wage threshold. So I think this is one example of how collective bargaining can really help to, in a flexible manner, also to adapt to the situation and to improve salaries in the long run in the fairest and most effective way possible.
Thank you very much. And LTCCovid brings together a lot of researchers. And as researchers, we often will say, oh yes, a lot of the problem is to do with workforce and is to do with, the low pay, the work. How can researchers help in this? So what kind of research is helpful to you? And then can you tell us a bit more about the way in which you think change can happen? That was great to hear these examples from Finland, and it's great to also hear more about how you might use knowledge that we researchers generate to try and achieve policy change. I don't know
Sylvain,
which one of you wants to start. You both look like you want to answer.
Sylvain, you can start if you like.
Sylvain.
The microphone works well, better. I would say our position paper we will provide you on the retention and recruitment gives lots of tracks where we together unions and employers think that things could be which could be done and which could have a positive impact on services. So I think that there are already some ideas and we need some evidence that it works. How it works, if it works well, which tools we should use, and I think lots of evidence and also some good practices collection would be very important for us. We will work on it together, but if we can gather also some other data, some other reflections, this very relevant. And to complete what Jakob said, on the employer side, the working conditions are very important because we need some staff to do the job, but we are convinced also on the employer side that better working conditions will lead to better quality services, which is something we want to improve. Then that's why we work together on this topic, because if we improve working conditions for workers, we will improve the quality of services for the benefit of both service users and workers, and everything will be better. That's something is challenging in our sector because, as we said, it's not attractive enough. That's not attractive enough because all these factors we mentioned must be worked on.
Thank you. And Jakob?
Yes, of course, I very much agree with Sylvain. I would also say that I found that in the recent months, there actually has been some very interesting research forthcoming that, of course, has been very, very useful for us. For instance, there has been a big report by the OECD on working conditions in long-term care. And something like this, of course, is very helpful for us. It looks at safety and health, it looks at salaries, it looks at working conditions. Next to this report, there is also a report forthcoming by the Social Protection Committee of the European Commission, which brings together member states, but also social partners. So Sylvain and also us, also EPSU, have been involved in bringing input to this report. Also, Eurofound is working on the effects of COVID on the sector. So I think there has been a lot of attention to this, and this is certainly very helpful. At EPSU, we also do research of our own, which then, of course, is, let's say, more trade union related, such as the one I mentioned before, what collective bargaining can do about the gender pay gap. Now we have one about the effects of privatization on long-term care and the effects of unionization. So this is, let's say, more oriented on that. And also together with the social employers, I think we, like Sylvain, I think mentioned already, the position paper on recruitment and retention, which lays out the general priorities, and also in the future, I think we can work together on especially safety and health. There is, for instance, the campaign from the EU OSHA coming up on healthy workplaces. So we try to actually stay in partnership with organizations where we can, but of course also follow organizations like the OECD, where we may be not as strictly involved in the research process, but that are still very useful.
Thank you very much. So, Sylvain, it sounds like
yes,
you'd like to come back in.
Yes, and I would mention also that in social employers, we also created an observatory where we intend to gather some information and data, and sometimes to make also some research on our side to give the tools to our members to be aware and to work on this kind of topics.
Thank you very much. So that's all we have time for today. I'm really grateful for you to take time and to explain. I think from the side of the perspective of the researchers, it's really useful to have this perspective. We're going to put all these links to the reports that you mentioned on the website together with the videos, so that anybody who's watching and listening can find out more. So thank you very much, and I look forward to continuing the conversation. Thank you.
Thank you.
Thank you.